and stand up for affordable and accessible health insurance for all Americans. Mr. Speaker, I yield back.
The gentlewoman from North Carolina reserves. The gentleman from Virginia is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1.5 minutes to the gentlewoman from North Carolina, Ms. Adams.
The gentlewoman from North Carolina is recognized for 1.5 minutes.
Thank you, Mr. Speaker. I want to thank the gentleman from Virginia for yielding and for his support on this issue. I rise today in strong support of H.R. 987. We must reverse the administration's attempt to sabotage the Affordable Care Act. Health care should not be a partisan issue. It doesn't matter if you're a Democrat, Republican, or unaffiliated. If you get sick, you need to see a doctor. You know, your body certainly doesn't make the distinction about what your politics are. The ACA has given millions of Americans, including 500,000 in my home state of North Carolina, access to quality and affordable care, and that's huge because people need health care. No one should worry about losing access to quality, affordable health insurance because of a pre-existing condition. We all have them. Black women shouldn't have to worry about dying in childbirth because they don't have equal access to health care. I am proud to support H.R. 987 to invest in quality health care for the American people, a health care system that works for everyone. I yield back.
The gentleman from Virginia reserves. The gentlelady from North Carolina is recognized.
Thank you, Mr. Chairman. I yield 3 minutes to the distinguished ranking member of the Veterans Affairs Committee, Dr. Rowe.
The gentleman from Tennessee is recognized for 3 minutes.
Thank you, Dr. Fox. I rise today in opposition to H.R. 987, the Democrats' Obamacare Bailout Act. This legislation includes 3 bipartisan bills that could help lower the cost of prescription drugs. Unfortunately, the majority's decided to package these positive bills with 4 bills that double down on trying to force Obamacare on people who don't want it and can't afford it. We're back on the floor again using valuable time to consider legislation that will not pass the Senate. Make no mistake, if House Democrats wanted to accomplish something, they could have put their 3 drug pricing bills on the floor by themselves today and they would have passed. Everyone needs to understand that. Instead of working together to find ways to bring down the cost of health care, House Democrats are acting to eliminate affordable options that many folks across the country rely upon for covering their families' health care needs. One provision in this bill would be to limit the availability of short-term limited duration plans to no more than 3 months. This change by President Obama went into effect January of 2017 and overturned 20 years of regulations that have been in place since Bill Clinton was in office, including the entirety of President Obama's administration. These plans offer essential health benefits chosen by the individual consumer, not the federal government. We need different needs at different points in our life. Unfortunately, the ACA does not allow for plans to be sold as compliant unless they contain government-approved what you need, not what you and your family decides what's in your best interest and can afford. If my colleagues want to get rid of junk plans, they can start by working with us to get rid of Obamacare. In my district, while the individual mandate was in effect, there were 20,000 people who purchased their coverage through the exchange and about 15,000 who paid the penalty. Many of those people who paid the penalty were able to find a plan that was affordable through the Tennessee Farm Bureau or the Christian Sharing Ministries. I've said it before, I'll say it again. Obamacare is a good deal for you if you get a subsidy, of which about 90% do. But these subsidies hide the true cost of the care. And for people who don't receive a subsidy, it's unaffordable. When the Education and Labor Committee marked up the short-term bill last month, I heard the argument that these short-term plans were too difficult to understand, that consumers don't know what they're getting. This is offensive to me. This is saying just because patients don't choose plans that Washington bureaucrats think is good for them, that they don't have enough sense to figure it out on their own. They do. I trust the American people. Why on earth, when we do something like common sense, creating association health plans, allow small groups to get together, Washington State does that, hardly a conservative state, They've had AHPs for over 20 years, and they're working well. My friends across the aisle want to engage in good faith effort to find solutions to high health care costs. I am all in, Mr. Chairman. I want to help. But the point is that people are finding ways outside of Obamacare to best access coverage for their families. The CBO initially said there would be 27 million people in the exchanges in 2019. That number is 8 million. I thank you. Competition works. I hope my colleagues oppose this legislation and are ready to work in a bipartisan way to solve these problems. And I yield back.
The gentleman's time is expired. The gentlewoman.
Mr. Chairman, could I inquire as to the amount of time left?
The gentlelady from North Carolina has 6.5 minutes. And the gentleman from Virginia has 10 minutes.
Thank you.
The gentlelady reserves. The gentleman from Virginia is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I yield 2 minutes to the gentleman from Rhode Island, Mr. Cicilline.
The gentleman from Rhode Island is recognized for 2 minutes.
Thank you, Mr. Speaker. Every day in kitchens and living rooms all across America, working men and women sit down and try to figure out how to pay for their prescription drugs. That's because 25% of the people in this country can't afford the medicine they've been prescribed. Seniors are choosing between COPD medicine and their groceries. People with cancer are being forced to delay their treatment, cut pills in half, or even forego treatment altogether. This is happening in the richest, most powerful nation in the history of the world. It's a disgrace. If government is going to work for the people, then the people who serve in government need to end this crisis. And Democrats are committed to doing just that. We're taking on the big pharmaceutical companies and their lobbyists, and we're going to get the job done. That's why I'm proud that my legislation, the CREATES Act, is included in this legislative package. The CREATES Act will save taxpayers $3.9 billion, according to the CBO, and bring down the cost of some prescription drugs by as much as 85%. The CREATES Act does this by directly addressing the abusive delay tactics that big drug companies use to block or delay generic competitors from entering the market. Over the past decade, some of the biggest drug companies have abused regulatory protocols so that they can prevent the sale of affordable drugs. This lets them maintain their control of the marketplace, pull in monopoly profits, and keep their prices at inflated levels. If it's signed into law, the CREATES Act will create a tailored path for generic drug competitors to obtain the samples that are necessary for regulatory approval of their lower-cost formulas. I'm proud that this bill is not only backed by many of our colleagues, but it also has the support of a diverse coalition of healthcare providers, patient groups, and public interest organizations, including AARP and Public Citizen. And I'm proud that it's included in this package today. The majority leader in the Senate likes to describe himself as the Grim Reaper for Democratic legislative proposals. I hope that won't be the case here. He needs to put the interest of the American people ahead of his obsession with fighting Democrats every step of the way. The CREATES Act and these other proposals that are contained in this package deserve an up or down vote in the United States Senate. The American people deserve relief from these outrageous prescription drug prices, and this legislation will achieve that. I thank the gentleman for yielding. I yield back.
The gentleman yields back. The gentleman from North Carolina, I'm Virginia reserved. The gentlelady from North Carolina is recognized.
Thank you, Mr. Chairman. I now yield 3 minutes to the distinguished Republican leader on the Subcommittee on Health, Employment, Labor, and Pensions, Mr. Wahlberg.
The gentleman is recognized for 3 minutes.
I thank the gentlelady. Mr. Chairman, I rise today in opposition to H.R. 987, and I truly lament the fact that the other side is once again, under their leadership's direction, trying to score political points instead of truly solving problems. Republicans and Democrats agree on the need to tackle out-of-control prescription drug costs. It's an issue that touches all of our districts. People are struggling and in need of relief. All of the names mentioned today, the illustrations from the Speaker of the House on to my colleagues, names that were mentioned of people that are hurting and need relief on drug costs are being let down by the Democrat leadership today. Up until today, we've been working together on solutions. On the Energy and Commerce Committee, on which I sit as well, we passed 3 drug pricing bills with overwhelming bipartisan support. The CREATES Act, the Protecting Consumer Access to Generic Drugs Act, and the Bringing Low-Cost Options and Competition While Keeping Incentives for New Generics Act. These bills would foster greater competition and help bring generic drugs to market as soon as possible and at more affordable prices. And once again, they all had bipartisan support. They were bills that were good bills. Unfortunately, the Democrats turned this bipartisan issue into a political football by adding several partisan provisions to this bill package, and they let down everyone that they've talked about today who needs affordable prescription drugs. They're costly provisions that bail out failed Obamacare programs and strip away affordable health care options for families. The Democrats also rejected a number of common sense amendments, including one I offered to protect expanded access to association health plans. These association health plans give more affordable options to workers and small businesses to purchase health care that fits their needs. We should be encouraging these options, not removing them. But most of all, today should be a moment of bipartisanship, a moment of meaningful results. We had an opportunity to get something done today on behalf of our constituents who are struggling with skyrocketing cost of prescription drugs. Instead, politics got in the way, and we missed that opportunity. The American people deserve better than that, and I think most of us are better than that. We stand ready to work on lowering prescription drug costs. I hope our colleagues on the other side of the aisle will talk to their leadership and put politics aside and join us in that effort. I believe we and they are better than that, and that if standing up to leadership that wants to make it political, if they do that, we can get this done. I stand ready to work. I hate to do this, Mr. Chairman. I want to keep talking about this and get a solution, but I yield back.
The gentleman's time has expired. The gentlelady reserves. The gentleman from Virginia is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1.5 minutes to the gentlewoman from Texas, Ms. Jackson Lee.
The gentlewoman from Texas is recognized for 1.5 minutes.
I thank the gentleman. I'm pleased to rise to support enthusiastically H.R. 987, Healthcare and Lowering Prescription Drug Cost Act. This omnibus bill combines 3 key bills to lower drug costs by promoting generic competition, long overdue, and 4 key bills to strengthen health care, reverse the GOP sabotage, and rescind the Trump administration's devastating junk plan rule. I know full well what happens when individuals are impacted by junk plans and they don't have the courage they need. I encourage my good friends on the other side of the aisle to drop politics and join with us to pass this legislation. This omnibus bill invests most of the savings of $13.8 billion created by its cracking down on junk plans into strengthening health care, which will fund about 500,000 additional enrollees into non-group coverage and Medicaid. Let me say to you, in 2017, due to the direct interference by Trump administration, the number of uninsured people increased by 700,000, the first increase since implementation of the Affordable Care Act. I know full well that Texas, which is a #1 state in the number of uninsured, is experiencing the devastation of not having the expanded Medicaid and the Affordable Care Act in its fullest. We had a roundtable discussion with people who experience diabetes. Insulin is going through the roof. These people are suffering. The average uninsured resident in my congressional district pays 23 more times for a form of insulin than people living in Australia, 15 more times than they would in the United Kingdom, and 13 more times than they would in Canada. Let's protect those with pre-existing condition, and let's pass this bill to bring down these drugs and save the lives of our constituents. I yield back.
The gentlelady's time is expired. The gentleman from Virginia reserved. The gentlelady from North Carolina is recognized.
Thank you, Mr. Chairman. I now yield 3 minutes to the gentleman from Idaho, Mr. Fulcher.
The gentleman from Idaho is recognized for 3 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I rise in opposition to H.R. 987 as well for a number of reasons, but one in particular that has been raised already is the provision that it terminates the short-term limited duration insurance provision. Now, these are a good thing, and they've been good for Idaho, and Idaho has been one of the states that's been leading on this front. And Mr. Speaker, before the Affordable Care Act, The average premium in our state was $1,915. After the Affordable Care Act, that premium average went to $5,267. And that's, from what I understand, not like what's happened in other states, because the young and the healthy left the plans. And that left the older, less healthy that were remaining in those plans. And it's driven those costs up. They've gone out, the younger and the more healthy have gone out of the plan altogether, or they've joined a MediShare. But the point is it's driven those numbers up significantly. In my state, our legislature passed a 3-year provision for short-term plans, and it's good for everyone. If you're in between those jobs, or if you're in between coverage for some reason, or you need to maintain continuity among the plans, it allows for that. Mr. Speaker, I've heard a couple of times these referred as junk. If they were junk, there wouldn't be such demand for it. I would reframe that argument to say that junk would be better described to the system that has driven those prices up from $1,915 to $5,267. We want to draw that younger constituency into those plans. Everyone wins. We all win when that's the case. Mr. Speaker, again, H.R. 987 strikes that provision, and for that reason, I will oppose it, and I ask my colleagues to do the same. Thank you.
The gentleman's time is yield back. The gentlelady reserved. The gentleman from Virginia is recognized.
Mr. Speaker, I yield 1.5 minutes to the gentlewoman from New York, Ms. Clark.
The gentlelady from New York is recognized for 1.5 minutes.
Thank you, Mr. Speaker. I'd like to, first of all, thank the gentlelady from Delaware, Ms. Blunt Rochester, for introducing this very important legislation, and thank Chairman Scott for yielding me time and for his leadership and support in continuing to provide access to quality health care for working families. As Vice Chair of the House Committee on Energy and Commerce, I'm happy to stand with my colleagues on the Education and Labor Committee to urge my colleagues to support the Strengthening Healthcare and Lowering Prescription Drug Prices Act. While H.R. 987 is not a panacea to the many challenges that we face in our nation's healthcare delivery system, it is sound legislation that will reduce drug pricing and increase market competition to bring generic drugs to the market sooner. It improves the lives of Americans by lowering the cost of premiums and out-of-pocket expenses, and presents a real financial hardship to Americans who have to struggle with limited resources. And they ask themselves, do I pay for medication, or do I purchase food or school fees or transportation to and from work? While my home state of New York has banned the sale of short-term health insurance plans, they are legal in other states and often do not provide the comprehensive level of health care insurance and coverage in the event of an emergency. Mr. Speaker, let's do the right thing and enact legislation that will lower the skyrocketing costs of prescription drugs and give protections to the consumers of health insurance coverage, lifting the burden off of access and affordability from the American people. With that, I yield back.
Has expired. The gentleman from Virginia reserves. The gentlelady from North Carolina is recognized.
Mr. Chairman, I'll reserve.
The gentlelady reserves. The gentleman from Virginia is recognized.
Thank you, Mr. Chairman. Mr. Chairman, I yield 1.5 minutes to the gentlewoman from Delaware, Ms. Blunt Rochester.
The gentlewoman from Delaware is recognized for 1.5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Chairman Scott. According to the Merriam Dictionary, sabotage is the act or process intended to hurt or hamper. When I'm a person who is really particular about words, and I've heard this word used a lot, and when I look at what has happened to the Affordable Care Act over the past few years, the administration has slashed the enrollment period, we've scrubbed the ACA from government websites, we've cut in-person assistance and eliminated almost all of the educational outreach for the open enrollment period. All of the administration's actions were intended to deliberately damage the ACA and hamper Americans' access to affordable quality health care. I don't question people's motivations. I think we all want the same thing. We all want health care for Americans. But this bill, H.R. 987, is intended to do two things. Number one, lower the cost of prescription drugs, and number two, strengthen this historic legislation, the ACA. Today, we have an opportunity to reverse the administration's relentless sabotage of the healthcare system and lower prescription drugs. And as I think about individuals in my state, I think about a woman who came to me crying because of the cost of her prescription drugs. Every one of us in here wants to see something happen. Today, we have the opportunity to make that happen. I urge my colleagues to support H.R. 987.
The gentle lady's time is expired. The gentle lady from Virginia is recognized.
The gentlelady will reserve, Mr. Chairman.
The gentle lady reserves, I'm in North Carolina. The gentleman from Virginia.
Mr. Chairman, I yield 2.5 minutes to the gentlewoman from Florida, Ms. Shalala.
The gentlewoman from Florida is recognized for 2.5 minutes.
I yield myself such time as I may consume. This amendment expresses a sense of Congress as the Secretary should not do anything that prohibits state insurance commissioners from allowing for so-called silver loading. Let me walk you through how we got to this point. Because while silver loading has worked to keep costs on the exchange lower for folks who get subsidies, it has only been used because the president was actively trying to kill the Affordable Care Act. In 2017, the president decided to stop reimbursing health insurance companies for what are called cost-sharing reductions, or CSRs. CSRs are payments that health insurance companies are required to make to help low and moderate income people afford health care. Under the Affordable Care Act, the health insurance companies must help people that have more affordable and possibly no co-pays or deductibles. The federal government was supposed to reimburse insurance providers for making these payments. However, in October of 2017, the administration stopped making these payments. This was a deliberate attempt to make health insurance on the exchange unaffordable and to undermine, weaken, and attack the Affordable Care Act. In response to this, states let health insurance plans do what is now called silver loading. State insurance regulators, in a desperate and creative attempt to stabilize the insurance marketplaces, allowed insurance companies to build the unpaid CSR costs into their silver plans on the exchange. This was a very creative attempt to stabilize the insurance market. This wasn't the solution that anyone wanted, but it is a solution that has worked and has created some stability and predictability in the insurance market in the face of an administration that seeks chaos. Because the tax credits are benchmarked to the silver plan, silver loading has meant that most who received subsidies did not see an increase in their health insurance premiums. In fact, new data shows that 2.6 million healthcare.gov consumers are now paying lower premiums as a result of silver loading. States that allowed for silver loading as a way to cope with the manufactured chaos that the administration tried to inflict on the market actually saw an increase in enrollment in the exchanges. The administration must stop trying to sabotage the Affordable Care Act.
I yield 15 additional seconds.
Thank you. The administration must stop trying to sabotage the Affordable Care Act. My amendment expresses that it's a sense of Congress that the Secretary of Health and Human Services shall not do anything to prohibit the use of silver loading, a program designed by the states to stabilize the health insurance marketplace. I reserve the balance of my time.
The gentleman's time has expired. The gentlelady from North Carolina.
I will continue to reserve.
The gentlelady, the gentleman from Virginia.
Mr. Chairman, can you give us an amount of time left on both sides?
From Virginia has 3/4 of a minute remaining, and the gentlelady from North Carolina has 1 minute remaining.
Mr. Chairman, do I have the right to close?
The gentleman enjoys the right to close.
Thank you. Now reserve. I'm ready to close.
The gentleman reserves. The gentlelady from North Carolina is recognized.
I'm prepared to close, Mr. Chairman.
She's recognized.
Mr. Chairman, Republicans predicted all the bad things that have resulted from the so-called Affordable Care Act. It has not been affordable, and it's actually increased the cost of health insurance and care. Unfortunately, our colleagues are so invested in supporting the legislation that they blame Republicans for its failure. The legislation has failed because it is hopelessly flawed and cannot be fixed. Mr. Chairman, the piece of legislation before us, as I said earlier, is a choice-limiting, freedom-limiting bill and should not pass. I'd also like to make one more observation. My colleagues have made repeated references to junk plans. Every time they do that, they're insulting the person who has chosen that plan for one reason or another, due to individual circumstances or preferences. Just because a product isn't something I would buy or you would buy, does that make it junk? No. Dismissing less expensive and more flexible health plans as junk isn't taking up for anyone, it's actually putting them down. That's not the way we should be in this country. Thank you, Mr. Chairman. I yield back the balance of my time.
The gentlewoman's lady, the time has expired. The gentleman from Virginia has 3/4 minutes.
Thank you, Mr. Speaker. I yield myself the balance of the time. Mr. Speaker, I just want to say a final word about these junk plans. The problem with them is that you allow them to screen for pre-existing conditions and have lower benefits. It might be a good idea for the person buying the plan, but what happens is, under the Affordable Care Act, everybody pays average. If you let healthy people buy these junk plans, everybody else's premium will go up. This sabotage has been estimated with this and the other sabotage, thousands of dollars more for everybody else left behind. So I rise today in support of the bill, which will include improve access to quality health coverage, protect the Affordable Care Act, and cut prescriptive drug costs. And I yield back the balance of my time.
The gentleman yields his time back. All time for general debate has expired. In lieu of the amendment in the nature of a substitute recommended by the Committee on Energy and Commerce, printed in the bill, an amendment in the nature of a substitute consisting of the text of the Rules Committee, print 116-14, shall be considered as adopted and shall be considered as an original bill for purpose of further amendment under the 5-minute rule. The bill as amended shall be considered as read. No further amendment to the bill as amended shall be in order except those printed in House Report 116-61. Each such further amendment may be offered only in the order printed in the report by a manager designated in the report, shall be considered read, shall be debatable for the time specified in the report, equally divided and controlled by the proponent and an opponent, shall not be subject to amendment, and shall not be subject to a demand for division of the question. It is now in order to consider amendment number 1, printed in House Report 116-61. For what purpose does the gentleman from New Jersey seek recognition?
Mr. Speaker, I have an amendment at the desk.
The clerk shall designate the amendment.
Amendment number 1, printed in House Report number 116-61, offered by Mr. Pallone of New Jersey.
Pursuant to House Resolution 377, the gentleman from New Jersey, Mr. Pallone, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from New Jersey.
Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman is recognized.
Mr. Chairman, I have an amendment sponsored by myself and the ranking member of the full committee, Mr. Walden. We have been considering the CREATES Act and the legislation like it for years, and has long been one of my top priorities. So I was pleased to announce a bipartisan amendment that gained the support of our Republican colleagues during Energy and Commerce consideration of the CREATES bill. There was only one outstanding concern still to be resolved after that amendment was adopted, and I'm pleased now to offer a bipartisan solution to address that concern today. The concern raised during our full committee markup was that there was a lack of specificity in the provisions that describe the communication requirements related to the request and the delivery of the requested samples between the eligible product developer and the license holder. This bipartisan amendment, filed by myself and my colleague, the ranking member of the Energy and Commerce Committee, Mr. Walden, will provide the additional needed clarity to ensure that communication requirements in these negotiations are understood so that there is certainty for both parties. So I think we have found agreement with our colleagues across the aisle around a shared goal of discouraging anti-competitive conduct and providing certainty to both brand and generic manufacturers about the sample request and delivery process. I appreciate the ranking member and his staff for working with me in good faith on this legislation and would urge all my colleagues to vote in support of this amendment, and I reserve the balance of my time, Mr. Chairman.
The gentleman reserves. Does the gentleman from Illinois seek recognition?
Thank you, Mr. Chairman. Mr. Chairman, thank you for recognizing me. I claim time in opposition, although we do not oppose this amendment.
Objection. The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, the chairman of the full committee is correct. We appreciate his help and support in working through these technical corrections. We don't oppose them, and with that, I yield back my time.
Back. The gentleman from New Jersey is recognized.
Mr. Chairman, I appreciate the comments from the gentleman from Illinois. Again, this is an effort to try to make sure that when a patent expires that the samples or formula are given to generics so they can develop a generic alternative. That's what the CREATES Act is all about. So with that, I would urge support for my amendment and yield back the balance of my time.
The gentleman yields back. The question is on the amendment offered by the gentleman from New Jersey. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Order to consider amendment number 2 printed in House Report 116-61. For what purpose does the gentleman from West Virginia seek recognition?
Mr. Chairman, I rise as the designee of the gentleman from Indiana, and I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 2, printed in House Report number 116-61, offered by Mr. McKinley of West Virginia.
Pursuant to House Resolution 377, the gentleman from Virginia, Mr. McKinley, and the member opposed, each will control 5 minutes. The gentleman recognizes, the chair recognizes the gentleman from West Virginia.
Thank you, Mr. Chairman. Bills to recognize lower drug prices passed Energy and Commerce with unanimous bipartisan support. They were genuine efforts to address the most expensive component of healthcare. But Democrats have packaged these bipartisan drug pricing solutions with controversial, ideologically driven legislation that will not be taken up by the Senate. Shame on them. So here we go again. According to the Washington Post, in so doing, the Democrats have put a pothole in the path of lowering drug pricing. We've all seen the chart. We've seen the quotes here earlier in the day. Look, Mr. Chairman, as the 11th most bipartisan member of the House, I recognize the importance of playing nice in the sandbox and putting good legislation before politics. This combination fails that test. My amendment is simple. It would strike the most controversial portions from the bill, leaving those areas that lower and allow us to lower the cost of prescription drugs. Therefore, if your goal is to lower the cost of prescription drugs, I would encourage my friends and my colleagues to vote yes on this amendment. But if you want to play politics with the health care of Americans and see this bill stopped in the Senate, then vote no. And you'll see what happens. Thank you. And I reserve the balance of my time.
The gentleman reserves. The purpose does the gentleman from New Jersey seek recognition?
Mr. Chairman, I would claim the time in opposition to the amendment.
Is recognized for 5 minutes.
I yield myself 2 minutes.
Gentleman is recognized for 2 minutes.
Mr. Chairman, I'm very disappointed that my Republican colleagues want to strike all of the ACA stabilization measures that we passed to our committee. These are important bills that should have strong bipartisan support, but unfortunately, my Republican colleagues continue to be unwilling to work together on common sense proposals that would lower healthcare costs for consumers. Funding for outreach and marketing. Why is this even controversial to my Republican colleagues? Outreach and advertising is critical to ensuring that people know about the option to enroll in comprehensive coverage. We know that last year, just 1 in 4 uninsured people who buy their own insurance were aware of the open enrollment season and the deadline to enroll in coverage. Another common sense proposal to lower healthcare costs is to provide funds to states to set up state-based marketplaces. Again, why is this controversial? Over the last few years, state-based marketplaces have had lower premiums and better enrollment than the federal marketplace. While enrollment on healthcare.gov has declined due to the Trump administration's sabotage, enrollment in the state-based marketplaces has actually increased. On the Navigator funding provisions, the Republicans are trying to strike from the bill again. This is a program to help hard-to-reach individuals, to help them in signing up for comprehensive coverage. Finally, the Republicans want to remove protection that would block the Trump administration's expansion of junk insurance plans that discriminate against people with pre-existing conditions. I really can't understand why my Republican colleagues who claim to support protections for pre-existing conditions want to defend these plans that discriminate against pre-existing conditions and put consumers at extreme financial risk, other than the fact that this is a Trump administration initiative, so they don't want to oppose it. In addition to discriminating against people with pre-existing conditions, these junk plans exclude coverage for many important benefits, such as maternity care. And even when you think you're covered, if you get sick while you're on one of these, the insurance companies find a way to avoid paying the bill. So in closing, this amendment demonstrates what we all know clearly, that Republicans don't want to do anything to actually help lower health care costs for Americans or safeguard pre-existing conditions protections. I urge opposition to this amendment.
Gentleman from West Virginia is recognized.
Mr. Chairman, again, this is the 3rd time today I've heard the word sabotage. So that must be the new operative word coming from my colleagues across the aisle. I would submit to you, I'll turn the tables back, because if there's someone trying to sabotage the effort of lowering health care prices, it's you. Because Mr. Chairman, or Chairman, our chairman on the other side, however, I think genuinely wanted to lower the health care prices when the bills came out in a nonpartisan fashion. Universally adopted by us. But someplace from the time they left Energy and Commerce to the time they came to the floor, they were put into something that the Senate has already indicated they have no appetite for. So if we truly want to lower health care prices in this vote, then it's a yes vote. But if you want to sabotage this legislation, you go right ahead and do what you have to do. So I know, Mr. Chairman, there were good efforts here, bipartisan efforts to try to get something done. It looks like something has creeped in to cause a problem. I yield back the balance of my time.
The gentleman yields back the Are advised to address their remarks to the chair. The gentleman from New Jersey is recognized.
Mr. Chairman, I yield a minute and a half now to the gentlewoman from Florida, Ms. Castor.
The gentlewoman from Florida is recognized for 1.5 minutes.
Mr. Speaker, we are trying to turn back the sabotage of the Trump administration on people's health care, the folks back home that we represent. The Trump administration has done everything they can to make it more expensive, whether we're talking about prescription drugs or that all-important health insurance policy. Don't just take it from me and my Democratic colleagues. Take it from folks who are on the side of our families day in and day out. The American Cancer Society Cancer Action Network, the American Diabetes Association, the American Heart Association, the American Lung Association. I could go on and on, but I'd ask unanimous consent to submit for the record letters from over 20 health groups that represent our families back home into the record that say, pass this bill.
And without objection.
Thank you. And I wanted to make one more important point. I've heard so much misinformation today from my colleagues on the other side of the aisle who have denigrated our navigators. They say agents and brokers can do the job of helping to sign up our neighbors for health insurance. Boy, that's not the case. Yes, agents and brokers are important, but we heard expert testimony in our committee that the navigators provide independent, trusted advice. They are our community-based folks at community health centers and groups like Cancer Society that I mentioned that understand how important it is. And a lot of the agents and brokers, they send their customers over to the navigators to sign up because the agents and brokers are not interested in going over to folks who rely on Medicaid or the Children's Health Insurance Program.
Time is
and at
expired.
this time, I'll yield back. My time.
Gentlemen, ladies' time is expired. The gentleman from New Jersey is recognized.
I yield now a minute and a half to the gentlewoman from Delaware.
Thank you, Mr.
The
Chairman.
gentlewoman from Delaware is recognized for 1.5 minutes.
Thank you, Mr. Chairman. I oppose this amendment because by stripping the ACA stabilization bills from this package, we're reneging on the promise that we made to the American people: access to quality, affordable health care. This complete package of bills helps stabilize the ACA, which will improve the risk pool, reduce premium cost, and lower the number of uninsured. The CBO found that my bill, the More Health Education Act, would help 5 million Americans obtain the high-quality health insurance created by the ACA. It's supported by AARP, the American Hospital Association, and a number of other organizations, as was mentioned before. And from day one, there has been a concern that when we shorten the amount of time that people can enroll, when we tell them that we're not going to let them know what is even available to them, and then we take away the resources and the individuals that can help them get there, that's why we feel like we have been watching and witnessing the move backwards. And what we want to do with this bill is move forward. So I urge my colleagues to reject this amendment and support the full legislative package for the people. Thank you. I yield back.
Gentleman, woman's time is expired. All time has. The gentleman from New Jersey has 15 seconds. You're recognized.
I would just ask opposition to this bill because it guts the effort to improve the Affordable Care Act.
Yields and all time is expired. The question is on the amendment offered by the gentleman from West Virginia. Those in favor say aye. Those opposed say no. In the opinion of the chair, the noes have it.
Chairman, I ask for the a roll call vote.
Does the gentleman seek a recorded vote?
Yes.
Pursuant to Clause 6 of Rule 18, further proceedings on the amendment offered by the gentleman from West Virginia will be postponed.
Is Kurt Schrader here? He wanted time.
All right, it is now in order to consider amendment number 3 printed in House Report 116-61. For what purpose does the gentleman from Vermont seek recognition?
This is me. Mr. Speaker, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 3, printed in House Report number 116-61, offered by Mr. Welch of Vermont.
Pursuant to House Resolution 377, the gentleman from Vermont, Mr. Welch, and a member opposed. Each will control 5 minutes. The chair recognizes the gentleman from Vermont.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentleman's recognized.
Mr. Speaker, this amendment, which I'll describe in a moment, is about improving and preserving the Affordable Care Act. The word sabotage has been used here. We don't need that word. We have a very straightforward, very transparent difference of view. The Democrats supported and passed the Affordable Care Act. We've been defending it for years. The Republicans opposed it. President Trump made it a campaign pledge to get rid of it, and they came within a vote in the Senate, except for John McCain, of repealing the law altogether. We don't have to use words that are pejorative. We think we should have the Affordable Care Act. We think we should make it stronger, and my colleagues on the other side of the aisle want to vote against it and now want to repeal it. One of the ways to make the Affordable Care Act effective is to have automatic re-enrollment. If a family is in the Affordable Care Act and the time for re-enrollment comes up, if they take no action, then they're automatically re-enrolled in the plan that they are already in. If you take away the automatic re-enrollment, folks fall off oftentimes for no particular reason. They were doing other things, they didn't notice about it, they didn't have the time, they didn't get to a navigator. There's lots of things that come between automatic re-enrollment or picking your own plan. And by the way, studies have shown that automatic re-enrollment, like automatic withdrawal to go into your retirement account, those are very, very effective. The president has indicated a desire to get rid of the automatic re-enrollment program. He hasn't done that yet. This amendment would prohibit him from doing that. Now, there's a reason why the administration would like to get rid of auto re-enrollment, because the evidence suggests that that would mean about 2 million Americans would then lose access to their health care because they hadn't re-enrolled. We don't want that to happen. We want those American families who depend on the health care that they have to continue receiving the health care next year, just like they received it this year. So this amendment makes it very clear that that automatic re-enrollment program would continue to be part of the Affordable Care Act. And keep in mind, it in no way limits the ability of a family, an individual, to decide to get into a different plan or to affirmatively say they don't want to be in any plan. That can still happen. So there's total and complete freedom of choice, but it gives security that's going to be very beneficial to about 2 million American families. And I reserve the balance of my time.
The gentleman reserves. The committee will rise informally to receive a message.